Let's talk about bleaching. Everybody likes to have white, light teeth, but we know that over time when we eat a lot of foods with staining elements like red wine, blueberries, coffee, etc., our teeth get stained. And the staining gets penetrated deep into the tooth. It's not just on the surface of the tooth, so when you go to the grocery store and buy toothpaste that's whitening, it really doesn't bleach your teeth, it just gets off the surface stain. So we do have a technique where we can actually pull out these deep stains inside the tooth, and that basically involves just having a chemical placed on the tooth that releases oxygen. When this oxygen gets absorbed deep into the tooth, it actually pulls out the yellow and the brown stains, and resulting in a lighter tooth color. Well, we have different methods of delivery to get this oxygen into the tooth. One is you can go to your local drugstore and buy an over-the-counter bleach system. These are available because the chemical in the bleach is not prescription. There are some issues though with over-the-counter products. One is you're not being supervised by a dentist, so you may end up having problems, and I have found with some of my patients who come in that they have sensitivity and they're not getting the colors that they like, and it's difficult to use. So over-the-counter may have its place, but we don't recommend it as your first choice. The other two methods of delivery is office or home bleaching. Office bleaching is where the patient will come in, and as you can see here on the screen, the patient is laying down in a chair, and they will have a very powerful bleaching solution placed onto their tooth, which means more oxygen is being released, so the process is done quicker. This has to be very carefully supervised because the chemical can be dangerous to the tissue. The second and most popular technique, though, is home bleaching, and this is where we will manufacture a custom tray for you. They'll come into our office, we'll take an impression of their mouth and make a model. From the model, we make them custom fitting trays, very comfortable, very thin, and in this tray they will dispense their solution that you will give to them. It's a very mild bleaching solution, so it's not harmful. The only downside to it is because it's milder, it's going to take a lot longer to bleach the teeth than just the office. So the solution that I've come up with that seems to work beautifully for our patients is a combination of both. We have them do one office session, which boosts their bleaching. It does about 30–40% of their bleaching job. Then they go home with their trays and their solution. They finish their job at home, which may take a few days to a week, depending on their situation. And then they always have their trays for maintenance when their teeth stain up later on, and they can just pop in their tray and re-bleach. All bleaching systems can cause sensitivity to the teeth, but with our system doing it in the office or at home, we have desensitizers that we can give for the patient, which will help relieve their sensitivity if they have it. Bleaching does not harm the teeth. It only works on natural tooth structure. So if you're going to have veneers done or you have old fillings, your bleaching must be done first in order to establish the color. The other limitation with bleaching is that you cannot order your color. You get what you get. But in actual fact, though, it's a win-win. People's teeth always lighten. So if this is something that really interests you, schedule an appointment, and I'll be very happy to sit down with you and go into this in much more detail.